Helping Seniors Television, all about improving quality of life for seniors. If you're a senior, know a senior, or plan to be a senior, then this show is for you. It's all about helping you develop your own aging plan so you can age actively and with dignity. Helping Seniors Television from the Helping Seniors Network of information, education, and resources.
I'm Kerry Fink, and welcome to Helping Seniors Television. We're here to help you make your best possible aging plan and give you the information you need to be able to be empowered for your golden years. So I have the privilege of sitting in for our president and founder, Joe Steckler, and we're so excited to be having today's topic is about getting the best in-home health care. And my guest today is Traci Graf with Avid Home Health Care Services. Hello, Traci. How are you today?
Hi, Kerry. Good.
It's good to see you. And we were talking about, our founder and president, Joe Steckler, has always talked about a thing that he says, getting the right element of care in your aging plan. We were talking about the fact that, throughout life, we're taught to plan ahead. So when we are growing up and going to school, they ask us, well, what's your plan for your career? What are you going to do? And then as we are in the workforce, they're telling us, well, you need to prepare for your kids' school, you need to prepare for your own retirement, and we're told all those things. And then we get towards our own retirement years. Why wouldn't we create our own aging plan that would cover the things that we hope to accomplish even in our golden years? And so one of the things that Joe has always talked about is finding the right element of care for the scenario that you're in. So you would choose what you need at the stage that you're at, understanding you may need more later or less later, but for right here at this stage, this is what I need. And I think that's one of the things that's going to be exciting about today's program when we talk about home health care is you made the statement as we were just chatting a little bit that you're really out to reinvent how home health care is done because sometimes it's not really working the right way for people. So let me, and I thought maybe a great place to begin with that would be to ask you just a little bit to tell us a little bit about your own story because you're a nurse, you come from this medical background, and you understand this as well as anybody.
Okay. I started very young in healthcare. I was a surgical technician in the OR.
Wow.
And I did that for 9 years straight. And then the last 7 years, I was a materials coordinator for surgical services.
Wow.
After that, I went to nursing school. And I came out and worked in psych for a year, in acute crisis center psych. And after that, I was very fortunate to have an incredible experience where I was working for the Gift of Life donor program in Philadelphia as an organ transplant coordinator.
Wow.
So, and we were generally taught to be quite assertive and outspoken and advocates for the donor, advocates for the recipients who weren't there to speak for themselves. So I burned out doing that, basically. I just burned out. It was a lot of long shifts, late nights, a lot of running around on call, and very emotionally draining.
Sure.
So I thought to myself, well, what can I do? Where can I go and work? What do I want to do? And I thought, I think I want to try home care. And so I created this little step down from stress plan for myself that I was going to go and start doing home care, which I had never done anything that gave me that kind of connection with a patient. And the second step was I was going to move to Florida. So I accomplished both of those goals. It took me a couple of years, but I transferred down here as a home care nurse with Gentiva, who now is Kindred, a big national. And the last 3 years before I took over Avid, I worked for Health First Home Care in the northern area of the county. So one thing that I definitely learned working for a hospital-based program like Health First was that there are really a lot of needy people out there in the community. And they're needy people that don't quite fit into the traditional services that is all that really seems to be available to people in this area. So for instance, say I was your Health First Home Care nurse and you had come home from the hospital after a urinary tract infection. and I come to your home with the doctor's order, discharge summary, and knowing everything that happened. And as we're talking and working through the episode, which is what Medicare calls it, I start to learn that one of the biggest challenges for you is hygiene. Something, first of all, you probably don't want to talk about as a patient. Second of all, nobody really wants to have someone have to come and help them shower. But as your nurse, I'm well aware that this little obstacle could be what is sending you back to the hospital over and over and over again.
Sure.
So the obstacle is that they need somebody to basically come in and help them shower, say 2 or 3 times a week for maybe an hour. There was nothing available when I was working in Health First, nothing. So most of the agencies that are like ours work on minimums, hourly minimums, 3 to 4 hour minimums, and it runs the gamut of what some of the costs are and reasons what drives the costs. But there was this large group of people that I saw as a nurse that were not getting service, that needed services. Things like maybe someone who doesn't have anyone living with them but had surgery, and yes, the home care coming from Medicare is taking care of their incision, helping them control their pain, you know, doing all those things, but who's helping them shower every day, or who's helping them change their sheets or do their laundry or cook them a fresh meal instead of something frozen? Who's going to get them to their post-op appointment with their doctor if they can't drive? So when it comes to those kind of needs, there really wasn't much available in the community. So Avid is not a chain. It was started by 2 friends of mine. One is a businesswoman, one is a nurse, and they're retired ladies. And they were my friends, and we would talk a lot about what was not out there in the community, what is lacking. And I would be outspoken sometimes about my frustrations in the kind of care that people were getting. The kind of care I saw people getting on the non-skilled nursing side, which is our kind of agency, wasn't that great. I mean, it seemed like nobody cared about consistency in caregivers. Nobody cared enough to really make an individualized plan. And I found that many times clients felt sort of pushed into it. They were forced into it by either the home care agency or their family or their doctor. And the agency that comes in to bring them on service comes in and talks to all of those people instead of the client. So now you've just tripled the way that they feel that this is being forced on me, I don't want this. So we developed a way to basically do it a little differently, approach the clients differently, create our care plans differently. They're more individual. I believe it's really important to have a good match with the caregiver. I mean, really, and consistency is so important, especially with clients who have dementia or memory problems, or they live alone and they have family members who live out of state. The family member out of state wants a consistent person to go to answer. Did mom take her medicine today? Did she make it to that doctor's appointment yesterday? And that's really where we fill in the gaps. The way I look at it is not everybody loses their independence all at once. Many of them, it starts like Swiss cheese. I stopped doing this because I can't do this part of it. A common one is I stopped cooking fresh meals because I can't tolerate the shopping, the preparing, the standing to do it, to cook it, clean it up. And I don't want to make a big meal for just me or 2 of us. So they forgo fresh meals because of that.
Well, isn't that a question that for most of us, do we understand when we use the word home health? You probably, with your experience, you're seeing it in all these stratifications or variations of levels of service. And to the average one of us at home that's just experiencing it, we don't understand the difference between somebody who's being sent out as follow-up to a particular case or something that's going on. I was just discharged from the hospital. I had knee surgery, so now I have somebody coming to my home to help me recuperate from that. And what you're where you're coming in is that as lifestyles adjust and things are going on, there's a whole element. But the typical person doesn't even understand maybe what those stratifications are. How, if you sat down with somebody, would you explain to them, we're a home health agency, and here's how we're going to help your mother, your father, or can help you or your husband as you guys are finding it more complicated to do things, to do things at home?
Right. Well, there's several kinds of home care. So there's skilled nursing home care, which is paid for by Medicare and health insurance.
And that's what you would normally see coming out of a hospital, right?
Correct. After surgery, after a new diagnosis, new medications, needing some teaching on something, multiple falls in the home can prompt that kind of service coming into your home. Non-skilled nursing non-skilled home care agencies are the kind that kind of do the things that the other agency doesn't do. They're usually private pay, out of pocket. Some people have long-term care policies that can pay for it. The VA has some programs that can pay for this kind of help. But, if you picture your typical day in the way you go about things, you have the Medicare side that will cover all of your actual medical needs. They'll take care of incisions, wounds, they'll do teaching. They have physical therapy, occupational therapy. They have home health aides as well that can help with showering. You have the non-skilled side that people hire privately. And it is basically to fill in the gaps where the other agencies don't cover. Things like showering, things like laundry, things like light housekeeping, transportation to and from doctors, social things. So there is also private duty nursing that can be done where it's a higher level of care that's needed, and they do only come usually in 4-hour, 6 or 12-hour blocks of time. They're CNAs, certified nursing assistants, or home health aides. So we kind of fit in between those two in some ways. If you don't need that level of care that private duty provides with like an LPN or an RN, and you're not meeting the Medicare criteria, you're kind of left in this gap. And that's where the non-skilled agencies come in. And there's a lot of them. And there's a lot of them that are doing a great job. And they have great staff and they take excellent care of people. But in my own experience, what I noticed was that there was really a lack of individualized care. And people would, and in turn, it makes it not successful because the client wants to drop services because they're paying for time they don't need, things like that.
Going back to the concept of home health, how does a decision get reached where somebody says, listen, it's time for me to call out for somebody for some help on all this?
We have a variety of reasons that people call us to come in. And I would say it's probably about 60-40 for the clients calling themselves and family calling. I think it's hard, like you were saying about planning. I think people have a really difficult time planning for when they will no longer be independent. Even people who are approaching it or are already there sometimes have a problem admitting that they need help with these things. So typically, depending upon the situation that we've been called in for, I try to find something, about the client specifically that maybe they could benefit from our services and sort of help them come around to seeing why they need the services too. A lot of people don't think about things because the way they lose pieces of their independence, it's kind of slow, and they accommodate and they adapt. And they accommodate and they adapt, and they change the way they do things, and they change what they eat and where they go. And Avid, we really like to be about keeping that independence. I say to people all the time, I'm not here for you to raise the white flag. That's not why I'm here.
No, if anything, it's funny because we've had a lot of conversations inside the helping seniors world where, again, we come back to this elements of care discussion where actually you are prolonging your safety and your ability to age at home by bringing in the help at the right times, even before you think it might be appropriate in your own mind, simply because, you know, the example that Joe often has talked about is if you have somebody in, maybe they're just simply providing you transportation or helping you with transportation to a grocery store or to a doctor's office, but you're getting used to having some help in certain areas.
Right.
Then you don't feel like you're taking such a giant leap if now you need the next level of help. And so particularly whether it's yourself looking at it, or maybe you're the parent or the adult child of a parent who's aging, and you say, wow, you know, mom isn't going to want anybody in the home with her. So, but maybe if we start with these first steps, then we're on the right path, and you're increasing safety and you're increasing the ability to succeed in that home environment for a longer period of time, I would think.
Definitely. I mean, as I see it, there's no reason, especially if you could afford to stay in your own home until the end of your life, there's really no reason that you can't. And our services can supplement both the Medicare, nursing, and hospice. We work really well with hospice as well. So, you know, I think that you're right, and people should be thinking ahead about it. Unfortunately, I don't think a lot of people do.
And I think some of it is that we don't understand. We're you know, most of the times we were having this conversation before that there's usually a crisis that precipitates. Now we're making decisions as fast as we can because we're required to, but it doesn't necessarily making the best decisions or the right decisions. And one of the things that we've also talked about in the helping seniors world is that you'll get a scenario where somebody could, if you thought about it on an overall sense, you could possibly age safely at home with the right help at home much less expensively than if you had to find yourself in a certain kind of a facility where the cost might be prohibitive, maybe even on your budget. And so that was a question I wanted to ask you. Is this an expensive service? When you said it's typically private pay, or maybe somebody has some long-term care insurance or some things that help, or maybe there's a VA benefit or something that can kick in, but is this an expensive service?
It can be, yeah, it can be. And especially if you're talking about, you know, 24/7 live-in care, that's $22 an hour or $20 an hour. It can be very expensive.
But when you back it down to where you come into it, what does that mean for the average person?
Well, when I talk to a client first, I take all of them on really as a long-term relationship. So that's just my own personal, and I do all of my own admissions. I realize at some point I may not be able to continue to do that, but I'm going to do it as long as I can. So, you know, I'll talk to the client about what their needs are, what they want, just sort of have a general conversation with them and try to get to know them a little bit first. And then, you know, I understand, and I share this with the clients, I understand it's really scary to take this step and have somebody come in your home. I mean, you're here with your husband or whatever, you're doing your regular thing you do every day, and now there's going to be some stranger in the kitchen.
Right.
It's awkward. You're not quite sure how this is going to go. Then they get caught up in what days, what times, and these are people who have never had this kind of help in their home before. Right. And one of the things about Avid is I'm committed to being very flexible with people because it's about them. Right. The service is about them, not about the agency. So if they need to start out slow with just a few hours, a couple times a week, to get comfortable and see if this is going to work for them, I have no problem doing that. Okay. And I explain to clients all the time that if you want to increase it, decrease it, change it, put services on hold because family's in town, you can do any of that with us. We're very, very flexible about the care we give. Okay. Because it's individual. It's about them, and finding somebody who connects well with the client and or the family is also very important.
I was going to ask you, that was one of the things that you had mentioned to me before we had the cameras rolling too, was that you found out in a lot of cases, and one of the reasons why you were committed to kind of reinventing the experience is because you wanted to see more of a focus on what the person needs rather than what the system prescribes. And you use that as an example, and we're talking to me about a lot of times one of the challenges is that in that kind of a caring environment, the person that may have dementia or something like that may be seeing a different face every week, so they don't know how to relate to that person. And then plus the person who is coming in to try to give the help, even though they may be quite good, they don't know all the things about that particular person.
Sure.
And don't get to learn how best to serve that person. And I thought that was an important point that you brought up when you said that's why we're here and we're kind of creating a new path or road. And I wanted to ask you a little bit about that. How do you bring that to pass in terms of getting people and providing that experience that is going to be most successful for the person you're trying to help?
Well, it really kind of goes back to my philosophy that I had as a home care nurse for Medicare nursing, and that was that I think that a lot of people in the medical field have forgotten that we are a customer service industry. We treat people poorly sometimes. We act like things are a secret sometimes. I find that just sometimes we're obstructive instead of being helpful.
Yeah. And
I just feel like the connection that you make with the client is where the real value is. As I've explained to a couple clients just in the past 2 days, that a companion who comes should be somebody that you look forward to them coming.
Right.
You know who's coming, you know what time they're coming, and you know what days they're coming. You're happy that they're coming that day. When they come in, you recognize them. They know your routine. They know your ins and outs. They know your personality changes. And with clients who have dementia or any kind of psychiatric issues going on, it's so valuable to have.
I was going to say it's even more important at that point.
Absolutely, because we forget about things like, okay, mom's forgetful.
Right.
When was the last time she had a bowel movement?
Right.
As a nurse, we ask those questions.
Sure.
And, people will call us, well, the client is having a lot of abdominal pain. When was the last time she had a bowel movement?
Right.
If nobody's paying attention, she doesn't remember when she had it.
Right.
So it's small things like that that can make all the difference with consistency with a caregiver, because somebody who comes 3 times a week knows that you might have gone to the bathroom 2 days ago.
So I sense that one of the things that you see as unique and helpful is the fact that you really approach it from that patient-centric point of view. So let me ask this. If you were talking to somebody, how would you advise them when's the right time to give you a call, and what's the process to start finding out if this is something that could be helpful in their own particular scenario?
So I think there's a couple things. Definitely people should consider finding an agency and getting connected to an agency if they're in a scenario where, say, it's a couple and the one spouse is healthy and independent and the other spouse is totally dependent on the other one. Because we see many scenarios where that happens. People maybe sign up to use us for transportation or as needed, and boom, the independent spouse goes in the hospital, and now the one who's left at home can't be left alone.
Right.
In that situation, it's much better to have planned ahead and gotten on board with an agency so that we don't have to go through the paperwork and the things like that. You've already done all that. We can just start to send people out.
Right.
The process doesn't take long. It really is just a phone call with some questions to the office, and then you book an appointment with me, and I come out to the home and do an assessment. We talk very specifically about what your needs are, what your likes and dislikes are. I try to get a real feel for what kind of personality are you? Are you someone that's going to feel challenged by someone coming in and doing things for you? And my brain starts to spin about my own staff and who I have that will match well with this person.
Okay.
Sometimes I will make a decision not necessarily based on level of care, but based on a good match with the people who need, a companion.
Sure.
I may send a home health aide because I know that this home health aide will match perfectly with this client. So we do things like that because I do believe I believe that connection is the absolute key to success.
So would you invite, we just have probably a minute or so left, but I wanted to ask you, do you feel like there's a right time to give a call? What if you don't necessarily even see, like, I'm not sure this is helpful yet, but just some of the scenarios that you described where, I'm taking care of her right now, it's okay, but like you said, that you could run into a situation where you may be down and the other person now is left without help. It would seem like it would be wise to give you guys a call early on just to sit down and open that process up to have these conversations.
It is, and I think people are afraid of obligation with having that conversation. I've told you I'm not really sure what other agencies do, but there is no obligation with us.
So it's worth giving you guys a call.
Sure, absolutely.
So we are out of time, but let me ask you to give a phone number if somebody's heard this and said, listen, I would like to call Traci and have her talk about my situation. What number do they give a call to?
321-392-3400.
Okay, and one more time?
321-392-3400.
And I hope that you will take advantage of this and find out the information that can help you make your own aging plan and figuring out how home health care can be part of that. So thank you, Traci, from Avid Home Health Care. You have a website too, right?
I do, www.avidhomecareservices.com.
And make sure that you find out more about what you can do at home to make the best aging plan for yourself and those you care about. I'm Kerry Fink for Helping Seniors of Brevard. Thanks for joining us today.
Steckler, thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses, and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we would welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.
For more information on helping seniors, call us at 321-473-7770, 321-473-7770.